Something as simple as a cough, sneeze, or laugh can trigger it. More than 38 million women in the United States cope with it, and it can create feelings of isolation, depression, and anxiety. Stress urinary incontinence affects 1 out of 3 women over the age of 35 and is considered to be the most embarrassing health condition women face.
It was always on my mind, 24/7. I was constantly reminded of it. And you know, it was a problem that wasn't going away. It was getting worse.
Stress urinary incontinence is caused by a weakening of the pelvic floor muscles and is often associated with pregnancy, childbirth, and hormone changes, among other factors. Sometimes when women do discuss the conditions with their primary care physician, it is commonly misdiagnosed as overactive bladder. Dr. Stephanie Molden explains why the misdiagnosis sometimes occurs.
Stress urinary incontinence is very straightforward. It's leakage of urine with coughing, sneezing, exercise, any activity, or any increase in abdominal pressure. Whereas overactive bladder is associated with urgency and frequency of urination, plus or minus the leakage associated with that urge. So it's very important to ask the right questions to the patient, not just do you have a leakage, but what incites your leakage or what provokes it.
Currently, medication is not available for the treatment of stress urinary incontinence in the United States. There are, however, outpatient procedures that are over 90% effective. By placing what is known as a sling to support the urethra, the small piece of surgical mesh can prevent the occurrence of future leaks. Patients often return home a few hours after the procedure and can typically return to work the next day. Rachel Kozar was a candidate for the procedure and talks about how she got her life back virtually overnight.
I had the procedure done on a Thursday and I went back to work on Monday. I could have gone back, my doctor even said that later that day if I really told her I had to. She was confident that I would be fine. So normal activities, again, the next day I was fine. I did wait 6 weeks to go back to exercising. I wanted to make sure that I wasn't going to be, harming anything. As a mother of 2 small children, and having to lift them up quickly, I was always, worried that I would leak while I was quickly picking them up. And now I don't have to give it a second thought. It's been great.
I think the most important thing to know about stress incontinence is that it's a very common problem affecting women and that there indeed is a good treatment available for the problem. It is a fairly simple condition to fix. It is actually one of my most favorite procedures to do because it is one of the more simple procedures that I perform, and it's a quick procedure with great outcomes.
Stress urinary incontinence can be life-altering, but it doesn't have to be that way. Through communication and guidance, women who currently suffer from this condition can be free to live life the way they want to.
I just feel so good about talking about it because it was a condition for me that was embarrassing and difficult to deal with, and now it's gone. And I just want to give that gift to other women, and let them know this is outpatient. It's nothing that's going to keep you immobilized for a long period of time. You can get right back to your family, right back to your activities, and it will absolutely change your life, change your quality of life, change your relationship with your family, and change who you feel that you are on the inside. So I absolutely 100% recommend this procedure.
LiveDryNow.com offers information on this condition ranging from its definition, treatment options, and the benefits and precautions patients should know when deciding on surgical intervention. It is an important tool in helping primary care physicians help the many women who come to their practice with this condition. Patients benefit by having a doctor who is proactive and knowledgeable in stress urinary incontinence, thereby creating a trusting and long-term doctor-patient relationship.
I've noticed that the patients for which I've treated with these procedures, when they come back to see me in the office, they're often the happiest patients I see. They wish they had done the procedure sooner. Most of them are cured, if not significantly improved, and they've had minimal pain and easy recovery. So I encourage, primary care physicians to inform their patients of the availability of such procedures.
The results have been extremely positive, no leakage, and my life is back.
For more information on stress urinary incontinence and the surgical options available, log on to LiveDryNow.com.